So Jenna Kothari set the background and she brought out some very interesting points about the disabilities and health concerns, and she said that one of the most complex issue was with people with psychosocial disability, and there are many nuanced information that needs to be elicited for it to be included in the recommendation. Second, Deepika set the context. Deepika set the context about the legal framework that we have in our country and also international statutes and what it says about health concerns of different constituencies. Praveen from BSO Delhi talked about National Urban Health Mission and the survey that they have done, and what they have brought out is that the ASHA workers are found to be very active, right, in identification. But one of the things that came out at the end of the day, that how much, especially Abdul mentioned that, as to how much can be burden the ASHA workers. If you're asking them to do early identification for blind people, if you're asking them to do suicide prevention, if you're asking them to do identification of hearing impaired, and with the money that government gives, how much can the ASHA worker do? That's a very big question that was left here in the room. Health concerns of persons with hearing disabilities and hearing impairments. Rajiv, you have to share.
Roma touched upon this issue, and what she basically spoke on was the issue of inaccessibility whenever a deaf person visits a doctor or a hospital, the communication barriers that are faced by a person with disability. She also touched upon initially on how during the first 3 years of a child, the concept of language comes in. And since the parents are not aware about the child's deafness, they try to communicate with an oral communication, and how that portion of the brain which registers language atrophies over a period of time. And so language remains a big accessibility issue for persons with deafness, which subsequently affects all their other areas when it comes to accessing health services. And then she also touched upon the issue of cochlear implants and how cochlear implants were successful, largely they were done within a certain age period. But we had one participant, Geeta Sharma from the National Association of the Deaf, whose experience is otherwise. We felt that cochlear implants were not very effective and that the child needs to be taught sign language. So the whole issue of accessing the health services for persons with hearing impairments remains the issue of communication barrier.
Dr. Sukhbindra Singh presented on health rights and accessibility. I think that was a very powerful presentation where it was clear that the government buildings and especially medical colleges and teaching institutes are not even aware of the barriers, and the recommendation should be to do regular audits of the buildings. And we also spoke about some of his own initiative which resulted in some positive action, where at least in one of the cases he highlighted a positive action post his activism. But there's a lot to be done. I think we have to put that in our recommendation. Mary Barua spoke about persons living with autism, and she clearly spelled out what are the major health issues when a person has autism. And she explained it in a very simple way, how we need to attend to their level of language to understand the health concerns, and she explained what is the problem in understanding their body in relation their health concerns gets missed out because of non-understanding of body in relation to space. Health concerns of persons living with multiple sclerosis. That's happening today. Okay. Health concerns of persons living with Alzheimer's.
Mr. Narendra spoke about issues of concern for persons living with dementia. He detailed to us initially what really dementia was, and he compared it to the hard disk of a computer. And he says that when there is a malfunction, a certain part of the memory of the hard disk disappears. And this is what we try to relate to what dementia really is about. That a certain part of the brain stops functioning, and as a result of which there are multiple things happening in the body of the person. It's a gradual memory loss which results in a lot of issues concerning day-to-day life of a person with dementia and Alzheimer's. We spoke about the issues of concern which start coming when a person suffers with dementia or Alzheimer's when it comes to activities of daily living. And for the caregiving concept, he sort of highlighted that it's important for a 24/7 caregiving which is required for persons living with dementia and Alzheimer's. And he also spoke about the various initiatives that the Association for Rehabilitation of Dementia, RC, the organization he represents, has started initiatives in certain parts of the country. And he also spoke about the engagement that he has had with the Ministry of Health, the Ministry of Social Justice, and what requires to be done for persons living with dementia. He did talk about a national trust which is being set up, likely to be set up with a purpose of 70 crores, which will look after issues of concern, caregiving issues basically of persons living with dementia.
Dr. Ratna Devi presented National Voice for Universal Healthcare and Access. It was very, very interesting. I think the first time we were hearing as to what we as patients or as persons should ask. And I think her entire presentation was person-centric, where she put the person in the center of the delivery services. And how many of us really ask questions like, when was the last, what is the condition of the USG missing machine, what is the condition of the X-ray machine? Because often if the machines are not calibrated, the results that they throw up could be wrong, and that can also trigger off other health issues in us.
Also in the context of disability, what I found very interesting was trying to correlate it to the issues of disability and health. Is that whenever disabled persons go to access health services, the communication barrier is huge, not only for persons with hearing impairment, but even persons with blindness, persons with other disabilities. Where a doctor treats the person with disability as a non-person, and any communication that he is having with the probably the family members. That was one connect which I was able to make. The other was that we in the disability sector have a lot of issues when it comes to persons with disabilities living in institutions. And all the institutions in the country today are state-owned. So what is the responsibility of the state when it comes to patient safety for persons with disabilities living in mental health institutions, institutions for homes for intellectually impaired, and then of course there is this huge issue of hopeless mentally ill, which Subir has been talking about, Subir from Canada has been talking about it. What about their safety? They're homeless, they're out on the streets, they don't have any access to any health services unless health services are provided by NGOs. And then there is this huge concern of safety. So that's a very, very interesting thing. And we really need to find out how we can, as a sector, engage with this IAPO, which is the International Alliance of Patients Organization for Safety and Access.
And the day ended with Abdul Mahmood's presentation on child mental health.
I know. Is he here?
No, he's not.
Abdul has been part of this process of ours since we started like Patna. And in all the zonal consultations that we've had, their presentations were kept last. So this was Abdul's biggest grouse against me, that you always keep child mental health last. So I said, no, this time I'll keep it last but on the first day. So he did express his dismay, but it was a very interesting presentation that he spoke about how mental health, as far as children are concerned, is such a major issue of concern today. He's handling a specific helpline, and in fact, when we were deciding on the dates of this consultation, he told me that don't keep the consultation on these dates, because these are the dates when these examinations are going to be happening in Delhi schools, and my helpline is going to be flooded with calls. So that speaks about child mental health, how today's life's pressures are affecting the mental health condition of a child, and how important it is for us to address this in our issues.
And I think Abdul raised a very critical point which went unheeded, and because it was at the end of the day we did not really respond, is, we all know that all the schools have counselors. So are the counselors compliant to the school management, or should they be compliant with the issues that children bring forward? So that was a very critical issue. And he also talked about power, how power is in the hands of medical experts, and how and what kind of damages it can do long term in one's understanding of health problems and health issues. Right, Pratik? So thank you very much and welcome to the second day, and hope it is going to be as stimulating as it was yesterday, and I will be talking to you later today. Thank you very much. Any questions, any burning questions which you really have to ask now? So Rajiv is here. And Deepika there. She's come.
Just a point that I want to raise, the last point that you made about counselors in schools. To counter this particular issue of where does the alliance of the counselor remain, and the whole threatening environment the child might face if the authorities are the ones who are the cause of this. Many schools, in fact, even in rural areas, there are many organizations who are promoting children's groups within schools. And these children's councils or children's parliament or Balsabhas or whatever they're called are the ones who then take these causes up. There the whole issue around children's voices being heard is being promoted.
I think that's a very important intervention that you made, Deepika. I think we can put it in the recommendation that children's tribunal or parliament must be held in each school. Yeah, thanks. So I hope there are no other questions, so we can start the day. Mr. Paul? Yeah, please. Is there?
We start today's sessions. It's going to be a packed day again like yesterday. We're starting off with health concerns of persons with hemophilia, and I invite Mr. Kaur to deliver a presentation on this.
Who next?
Will become Good morning, friends. Good morning, Rajiv ji, and thank you for